All right, let's talk about Atlanta. It's a city that's absolutely booming, full of growth and incredible history. But just beneath that shiny surface, there's a serious crisis unfolding, and it's one that's measured in minutes, in miles, and ultimately in human lives. So that brings us to this big, urgent question we've got to ask. How is it even possible that in a major American city, right now, today, the street you happen to live on could be the single biggest factor in whether or not you survive a medical emergency? The answer? Well, it reveals a system that's at a breaking point.
Okay, I want you to picture this. It's 2 in the morning. You live somewhere in South Atlanta, maybe Mechanicsville. You wake up with that terrifying, crushing feeling in your chest. You know what it is. It's a heart attack. Now, in a perfect world, an ambulance is at your door in 8 minutes. You're getting life-saving care within 30. But we're not talking about a perfect world, are we? Nope. We're talking about Atlanta. Right now.
And look, that scenario, that's not just some story I made up. For thousands of people, it is their lived reality. And it just pulls back the curtain on this fundamental truth. There are really two Atlantas. For some, healthcare is world-class. It's right around the corner. But for so many others, the system just plain doesn't work. So let's dig into how we even got to this point.
It really all came to a head back in 2022 when the Atlanta Medical Center, or AMC, shut its doors for good. And you know, this wasn't just any hospital. It was a level 1 trauma center, a critical safety net for the whole community. When it closed, it just ripped this gaping hole in the city's healthcare system, creating what's basically a medical desert. This hit especially hard in the Black Butterfly. That's the name for the arc of predominantly black neighborhoods that sweep across the south of the city. All of a sudden, one hospital, Grady Memorial, had to try and absorb this tidal wave of patients it was never, ever built to handle all by itself.
So, okay, what does that strain actually look like on the ground? This is where we got to follow the data, because the numbers, they don't lie. They tell a story that is absolutely impossible to ignore. And we're going to zero in on one key number. You've probably never even heard of it, but trust me, it reveals everything.
It's called APOT, or Ambulance Patient Offload Time. It sounds complicated, but it's really simple. It's just how long an ambulance is stuck at the ER, waiting before they can actually hand off their patient to the hospital staff. And think about the dangerous domino effect here. An ambulance that's stuck waiting? It's not just a delay for that one person. It's an ambulance that's off the street, unable to answer the next 911 call, which could be yours.
And here is the reality in Atlanta today. Less than half, only 46% of patients are getting offloaded in that 20-minute target window. Let that sink in for a second. More than half the time, these ambulances are just sitting there, stuck in a line at the hospital. They've literally become waiting rooms on wheels, completely unable to get back out there for the next emergency.
And you can see how this all plays out on a map. It is stark. Down in South DeKalb, you could be waiting an average of 19 minutes for an ambulance. 19. Now you go up to North Fulton, where there are a bunch of hospitals, that time gets cut in half. We're talking 19 minutes versus 9.5. I mean, come on. For a stroke, for a heart attack, that's not just a delay. That's the difference between life and death, plain and simple.
You can see this strain in the hospital's safety grades, too. No surprise, Piedmont up in wealthy Buckhead, it's got an A. But what about Grady and Emory Midtown, the two hospitals taking on almost all the extra load from AMC's closure? They're both sitting at a C. And I need to be absolutely crystal clear about this. This is not a reflection on the amazing, heroic doctors and nurses busting their tails in those hospitals. It has nothing to do with them. It's all about the impossible, completely unsustainable situation they've been thrown into.
I mean, what do you expect? That C grade is what you get when a hospital is forced to run at 110% 24/7. When every single bed is full, the ER is spilling out into the hallway, of course things are going to get missed. The staff is stretched to the breaking point. So yeah, that grade, it's a direct result of a city that basically dumped its entire burden of care for the poor and uninsured onto the backs of just 2 hospitals.
And this is where the story gets even harder to tell. This is the deepest, most human cost of this whole crisis. Because, you know, when a system like this starts to crack, it's always the most vulnerable people who fall through those cracks. And right now in Atlanta, we really need to talk about mothers.
Just look at this number. It's a national embarrassment, honestly. For every 100,000 births in Georgia, nearly 38 mothers die. That is one of the worst rates in the entire country. But believe it or not, the story gets even worse when you zoom in. Because if you are a black woman in Atlanta, your risk of dying from something related to your pregnancy is more than double that already horrible number. Just think about that. This isn't just some data point on a chart. This is a 5-alarm fire, a crisis of inequity that we have to pay attention to.
And it's not just mothers, it's their babies too.
The March of Dimes gave Georgia a grade for preterm births. You want to know what it was? An F. A failing grade. An F! In a state that is literally home to the CDC, the Centers for Disease Control and Prevention. The irony. The disconnect is just staggering.
So you have to ask, why? Why is this happening? And it's so much deeper than just not having a clinic nearby. Researchers have a name for this phenomenon. They call it weathering. And it's exactly what it sounds like. It's the physical, cumulative wear and tear on your body that comes from the chronic, day in, day out stress of dealing with poverty and discrimination. It's the high blood pressure you can't manage because getting to the pharmacy takes 3 different buses. It's a lifetime of that kind of stress literally breaking down your body.
Okay, so I know this all paints a really bleak picture, and it is. But the story is not over, not by a long shot. Atlanta is standing at a major crossroads right now. And there are these incredible glimmers of hope starting to pop up from the community, even while the big top-down decisions are still hanging in the balance.
Check this out. This is one of my favorite examples. Over at Grady, they started this program called Food as Medicine. And it is so brilliantly simple, it's genius. So a doctor sees a patient, someone who has an illness like diabetes that's tied to their diet, and they realize this person just can't afford healthy food. So the doctor writes a prescription, not for a pill, but for fresh fruits and vegetables. Then the patient takes that prescription downstairs to the hospital's own little grocery store and fills it for free. How cool is that? That's healthcare that treats the root cause and gives people their dignity.
Then, on the other end of the spectrum, there's the really big idea, the potential top-down solution. Right now, it's mostly just whispers and rumors, but it's called Project Robin. And the idea is a city-backed plan to build a brand new, state-of-the-art hospital on the west side, exactly where this medical desert is.
And the price tag they're talking about? It's huge. We're talking $800 million. If this thing actually happens, it would be the biggest investment in health equity in the history of Atlanta. Period. It could completely change the game. But, and this is a big but, right now, it's still just a rumor. Just an idea on paper. And that brings us to the final and maybe the most telling piece of this puzzle. Because while all this talk about Project Robin is happening, you have to look at what's actually going on at the old AMC site. The very spot that used to have life-saving trauma bays for the entire community is now being turned into fancy apartments and these kind of vague wellness clinics. Let's be real. We are literally watching emergency rooms get replaced with luxury rentals.
So this is the choice, isn't it? This is the crossroads Atlanta is at. Do you build the infrastructure that people desperately need to survive, or do you just build more real estate? Is this city going to build a bridge to close this healthcare gap, or is it going to let it grow into a permanent, uncrossable canyon? The answer to that question is going to define Atlanta for a long, long time.